is Dr. Nica Taloma, and once again, we will be having a lecture on pathologic obstetrics. So for this time, for this period, we will be discussing intrapartum complications of pregnancy. And when we say intrapartum complications, if you remember earlier, we discussed antepartum. So when we say intrapartum, this is already during labor and delivery. So what are these complications? So first, we have what we call premature rupture of membranes. We will also discuss preterm labor. So if you notice, these are already occurring during labor and delivery. We also have Vasa Previa, umbilical cord prolapse. We have prolonged pregnancy, dystocia, or in other words, dysfunctional labor, shoulder dystocia, induction of labor, uterine rupture, placenta accreta, cesarean birth, uterine inversion, and early postpartum hemorrhage. So these are the most common occurring complications during intrapartum. So these are the things that we will also discuss. So we'll start off with PROM. When you see this acronym class, always remember the meaning. So P stands for premature rupture of membranes. PROM. Premature rupture of membranes. So this is the rupture of the chorion and amnion before the onset of labor. So first, let's define, or let's try to understand, what do we mean when we say amnion and chorion? So this is the uterus of the mother class. We have here the baby, and the baby is surrounded by an amniotic sac. So may nakapalibot sa kanya na parang balloon, and we call that amniotic sac. This amniotic sac, it has two parts. We have the inner portion, we call that the amnion, yung inner na lining, and then the outer portion is the chorion. So, kailan ba dapat nagra-rupture ang bag of water or yung membranes natin or amniotic sac? This should only rupture during labor. Dapat nagsimula ng mag-labor ang mother, tapos dun siya magra-rupture. When we talk about labor, paano mo ba masasabi? First, you have to know, how do you know if the mother is in labor? So we see that the mother is in labor, first, if nagkaroon na ng opening ang cervix. Pag inai mo si mother, ipapasok mo yung dalawang daliri mo, at inai mo siya, mararamdaman mo na yung cervix niya nag-open na. So that is one thing na masasabi mo nagle-labor na si mother. Pangalawa, yung contractions ng matres niya, ng uterus niya, are already regular. So nagiging regular na. So doon natin masasabi, nagle-labor na si mother. So ang nangyayari, class, pag sinabi natin premature, hindi pa dapat mag-rupture yung membranes niya. Pumutok na yung panubigan ni mother, kaya premature. Ibig sabihin, class, hindi pa open ang cervix, hindi pa regular ang contractions ni mother, pero pumutok na ang panubigan niya. Anong ibig sabihin nun? Or tawag natin doon? Premature rupture of membranes. Now, the cause of this, class, is unknown. Hindi talaga natin masabi specifically what caused it. But of course, in its pathophysiology, meron mga risk factors or associated conditions that may lead to the premature rupture of membranes. So first, we have associated with malpresentation. Malpresentation. Ano ibig sabihin natin sa malpresentation? So when we talk about malpresentation, ano ba dapat ang normal na presentation ng baby? It should be cephalic, di ba? Nauna dapat ang ulo. Pero what if shoulder ang presentation? Yung shoulder ang presenting portion dito. That is considered a malpresentation. Ano pa? Pwedeng compound presentation. Aside sa ulo ni baby, nakaganon yung kamay niya, so ito yung unang lalabas sa cervix. That is also considered malpresentation. Next is weak areas in the amniotic sac. So there may be times that there are areas in the amniotic sac na weak. So dahil may weak, halimbawa this portion is a weak part of the amniotic sac, pwede siyang pumutok. Next, we have subclinical infection. So merong infection si mother. Doc, anong ibig sabihin ng subclinical? When we say subclinical, class, may infection si mother na ongoing pero wala tayong nakikitang symptoms. Kung meron mang symptoms, these are very vague symptoms. Hindi masyadong obvious na may infection pala si mother. So we call that subclinical infection. Next, we also have another is incompetent cervix. Remember class, we already discussed this. Di ba pag sinabi natin incompetent cervix, dapat ang cervix sarado pa. Pero nag-o-open na siya. So incompetent cervix. So next we have if we develop premature rupture of membrane, this will lead to chorioamnionitis. Remember class, when you see the suffix itis, it means infection. Pag sinabi mo ang chorioamnionitis, anong may infection? Diba sabi natin kanina, the amniotic sac is lined by an amnion and a chorion. So if it is inflamed, pag may infection ang amniotic sac, we call that chorioamnionitis. Kasi pumutok na yung panubigan. So pwedeng mag-develop ng infection. Now, in the latent period, from premature rupture of membrane to onset of labor, if it is greater than 24 hours, there is a high risk of infection. So tatandaan niyo to class, pag nag-duty kayo sa hospital later on, at meron tayong mother na pumutok ang panubigan niya na prematurely or merong PROM, inoorasan niya ng doktor. So, oorasan niya yan. Pag nag-start na greater than 18 hours at hindi pa nagpo-progress ang labor ni mother, nagkakaroon na tayo ng apprehension kasi pwedeng magkaroon ng infection. At pag may infection, pwede itong mag-cause din ng more complications kay baby. Okay. Now, what can we see? What are our assessment findings for PROM? Paano natin malalaman? So first is amniotic fluid gushing from the vagina. Anong sasabihin sa'yo ng mother pagpunta sa'yo sa hospital? Doc or mom, nurse or midwife, sasabihin niya, pagkagising ko basa na kaagad yung bed ko pero hindi naman po ako nakaihi. Anong tatanungin mo? Ano po ang amoy nung lumabas sa inyong fluid? So sasabihin niya, tatanungin mo, parang amoy ihi ba ito? Pag sinabi niya hindi naman siya amoy ihi, anong kulay? Clear lang po na white po yung color niya. So pag ganun, pwedeng nating i-inspect, check natin yung panty ng mother, kung hindi pa niya to pinalitan, to check what's the color and the smell. Okay? Very important yan na assessment. Next is pulling of amniotic fluid in the vagina during a speculum examination. So in this picture, we can see here a mother in a lithotomy position. Nagpasok siya ng speculum. Makikita mo sa speculum, tingnan nyo, parang may tubig doon na nagpupul or namumuo na tubig dito sa part ng vagina, di ba? So this is already a sign that your amniotic membrane has already ruptured. Now, aside from that class, if the mother develops fever and the baby develops tachycardia, bumilis na yung heart rate ni baby at nagkakaroon na ng ibang amoy yung discharge niya, what do we already suspect here? We already suspect infection. Isipin mo na chorioamnionitis. Okay. Now, aside from this assessment findings class, meron din tayong laboratory findings. We have what we call ferning. So, pag makikita natin dito class, pag kumuha ka ng result class, we have this result na tinatawag nating ferning. So, ganito yung itsura niya. Okay, pag meron tayong result na ferning, ibig sabihin these are already amniotic fluid. Ibang-iba ang itsura ng urine pag tinignan natin sa microscope as compared to the amniotic fluid na merong ferning pattern. Another test is the nitrazine test, which turns blue-green. So pag nilagay natin itong nitrazine test dito sa amniotic fluid, if it will turn green, ibig sabihin nag-rupture na yung membrane mo. Kasi bakit blue-green? Because the fluid is alkaline. Kapag urine kasi yan, acidic. Kagaya nito, pag acidic ang color, ibig sabihin yellow, ibig sabihin ihi lang yung lumabas, hindi siya amniotic fluid. But if it turns to blue-green, then you will know that this is already ruptured membranes and meron na tayong nagli-leak na amniotic fluid. Okay, so how do we manage this case? The management would be number 1, to keep vaginal examinations to a minimum to prevent infection. Ibig sabihin, pwede ka bang IE ng IE? After 15 minutes, pwede bang i-IE mo na naman si mother? After 30 minutes, IE mo na naman siya? Hindi pwede. Kasi class, kapag parati natin i-IE or internal examination ng mother, this may lead to infection. Okay? So we also have to make sure that if we perform an IE, dapat we do this in such a way na hindi siya magkakos ng infection. Next, we have to obtain smear specimens to test for beta hemolytic strep. Doc, ano po ang beta hemolytic strep? So this is a type of bacteria class. Strep stands for Streptococcus. So beta hemolytic streptococcus. Kailangan natin i-check yan kasi if it develops or pag nag-positive, ibig sabihin, it may affect also the baby. Now, we have to monitor maternal and fetal status for signs of infection. Again, anong makikita natin na sign of infection kay mother? That would be fever. Kapag baby naman, titignan natin yung heart rate niya. Kapag masyadong mabilis or yung tinatawag nating tachycardia, then that is also a sign of infection. Next, bed rest if the presenting part is not engaged to prevent cord prolapse. Okay, tingnan natin to class ha. This is what we call cord prolapse. Ayan, cord prolapse. Anong napansin nyo? Yung cord, siya pa yung unang lumabas, di ba? Delikado ba itong cord prolapse? The answer is yes. Bakit? Class, tignan nyo ito. Ito ang tinatawag nating placenta. From the mother, lahat ng mga nutrients dadaan dito sa placenta. Pupunta kay baby, oxygen and nutrients going to the baby. Now, dadaan siya dito sa umbilical cord class, papunta sa umbilicus ni baby para mapunta sa buong katawan niya. Now, remember, if meron tayong cord prolapse at itong ulo ni baby, for example, nagko-contract na ang mattress ni mother at yung ulo ni baby mape-press against that cord. Parang iipitin niya yan eh. So, pag naipit yung cord, just imagine, it will occlude the cord. Hindi makakadaan ang nutrients papunta kay baby. Is that very dangerous? Yes. Pwedeng mag-lead yan into fetal distress. Walang oxygen na mapumupunta kay baby, that will lead to bradycardia. Hihina ang tibok ng puso ni baby. Remember, chine-check natin parati ang heart rate ni baby. Tapos pag bumabagal, nagpapanik na ang mga OB dyan. Isi-CS nila kaagad kasi baka tuluyan nang mawala si baby or mamatay. Okay, so class, take note, if the head is not yet engaged, or halimbawa, breech position siya at hindi pa engaged, you have to put the mother on complete bed rest. Now, if it is already engaged, yung presenting part, if it's the fetal head, and if it is already engaged, we encourage ambulation. Okay? Ambulation. And of course, we also have what we call prophylactic antibiotic. So, in-explain ko na sa inyo dati anong ibig sabihin ng prophylactic. Prophylactic means we are giving it to prevent infection from occurring. Wala pang infection pero nag-antibiotic na tayo because we want to treat the antibiotic we want to treat the infection or we want to prevent rather the infection kaya siya prophylactic antibiotic. So, nagbibigay tayo ng ampicillin kay mother. So, those are the things that we need to take notes sa PROM or premature rupture of membrane. Again, chorioamnionitis is the infection of the amniotic sac. So, this is due to bacteria that ascends through the cervix going to the amniotic fluid. Okay, that is premature rupture of membrane. Now, let's proceed to the other topic, which is preterm labor. So, when we talk about preterm labor, tignan niyo yung baby class, super liit niya, di ba? Parang pag ilagay mo yung palm mo, parang kasya, pwede mo siyang buhatin. Totoo ba talaga na may mga baby na ganito kaliit nung pinanganak? Yes. May mga nabubuhay ba? Meron naman. Even dito sa atin sa Region 2 and in Cagayan, there are hospitals na our doctors, specifically our neonatologists, who are able to help this child or children survive. So when we say preterm, pre means bago. Before pa niya na-reach ang maturity or term, nag-labor na si mother. So, labor that occurs after 20 weeks. So, after dapat kasi kung before 20 weeks, anong tawag natin doon? Abortion. So, labor that occurs after 20 weeks and before 37 weeks age of gestation. Kasi class, pag na-reach yan ng 37 weeks age of gestation, ang tawag na natin doon ay term. Hindi na siya preterm. Okay? So, anything below 20 weeks AOG is abortion. Anything between 20 weeks and 37 weeks, we call that preterm labor. So, ano yung mga causes niya? So, remember, yung premature rupture of membranes, it can also lead to preterm labor. What else? We have preeclampsia. Remember niyo yung preeclampsia class? Mataas ang blood pressure ni mother, tama? So, this may also lead to preterm labor. Kaya kailangan, pag may preeclampsia, we need to control the blood pressure. Next, we have hydramnios. Okay, if you remember this, what does this mean? Ang other term natin dito is polyhydramnios. Ibig sabihin, excessive amniotic fluid. Ang amniotic fluid niya is greater than 1,800 ml or 2,000 ml. Okay, we also have placenta previa. Remember yung placenta previa? This is low-lying placenta. Either it partially occludes or completely occludes the cervix. We also have abruptio placenta. If you remember class, this means nagkaroon tayo ng premature separation of the placenta. Humiwalay na yung placenta sa uterus even before labor. Another risk factor would be, or another possible cause is incompetent cervix. Remember class, pag nag-open ang cervix, hindi mo na yan ma-prevent ang labor. So pag nag-open ang cervix at 30 weeks, then we call that preterm labor. No, another class is trauma. Halimbawa, nagbiyahe ang mother tapos nagkaroon ng vehicular accident, nagkaroon ng trauma, abdominal trauma. Then this may also lead to contractions leading to preterm labor. We also have uterine structural abnormalities. Halimbawa, retroverted. Okay? Or pwede rin meron siyang myoma or polyps. So this can lead to preterm labor. Next, we also have multiple gestation. Halimbawa, kambal, triplets, or quadruplets, or mas madami pa, di ba? Kapag ganun karami ang anak, mas malaki rin ang tiyan. Pag mas malaki ang tiyan, mas mabilis siya mag-stretch. Pag na-stretch siya, tendency is magko-contract na ngayon yung uterus. Di ba? Parang yung rubber band na masyadong na-stretch, mabilis siyang bumalik, okay? So, merong pressure pabalik. So, yun naman, multiple gestation. Another possible cause is chorioamnionitis or any type of infection. Kapag may UTI ang mother, remember class ha, pag may UTI ang mother at hindi pa term ang pregnancy, very prone sila to develop preterm labor. So, you have to be very careful about it. Next, we have congenital adrenal hyperplasia. So, ito naman class is a condition sa baby. And if this happens, nagkakaroon tayo ng adrenal hyperplasia, it may also lead to preterm labor. Another is fetal death. Halimbawa, namatay na yung baby sa loob. This may also lead to preterm labor. Okay, and we have maternal factors such as stress, UTI, ayan, sabi ko kaya kailangan natin i-treat. Akala natin simple lang ang UTI, pero if that is not treated, it may lead to preterm labor. And of course, class, we have dehydration. Doc, kahit dehydration lang pwedeng mag-cause ng preterm labor. Yes, class, anything that also disrupts or causes stress sa mother may lead to preterm labor. Now, anong mga manifestations natin sa mother pag may preterm labor? So, sakit ang likod niyan. Remember, class, labor pa din ito. So, paano nararamdaman ng mother na symptoms sa labor, yun din ang mararamdaman niya. So, sasakit ang likod niya. So, sa suprapubic area, dito sa taas ng pubis, mons pubis, there is pressure, masakit din. There's also vaginal pressures, parang ang bigat, okay? And then, we have rhythmic uterine contractions. So, sabi nga natin, pag nagle-labor, yung uterine contractions niya is already regular. And of course, class, ito ang pinaka-important. Masasabi mo lang na nagle-labor ang mother kapag ang cervix niya ay nag-open, nag-dilate, or nag-efface. And nag-efface. So, also, another na pwede natin makita is if nag-rupture na ang membranes niya. And then expulsion of the cervical mucus plug. Anong other term natin dito? The show, di ba? Yung show, parang may biglang lumabas na may dugo, na medyo sticky. Ang tawag natin dyan, mucus plug or the bloody show. Ito na yon. Same lang to class. Expulsion of the cervical mucus plug and bloody show, those are the same. Now, anong management natin for patients who manifest or who has preterm labor? Dalawa yan, class. Siyempre, as much as possible, ayaw pa sana natin lumabas si baby. Gusto muna sana natin siyang lumaki sa loob. Kasi hindi pa siya ready. Preterm pa lang siya. Now, i-check kayo ng doktor yan. If the centimeter or if the cervix is less than 4 centimeters dilated, ibig sabihin pag inai mo at finil mo yung cervix, hindi pa siya hihigit sa 4 centimeters ang opening. So, ibig sabihin maliit pa, nasa latent phase of labor pa lang tayo. So, what we can do is we try to prolong yung ipaprolong natin na hindi muna mag-labor si mother. So, ibe-bed rest mo yan. Hindi mo papalakarin or papatayuin. Tocolysis, ang ibig sabihin ng lysis is to stop. Toco means contraction. So, to stop uterine contraction. Bibigyan mo siya ng mga gamot na mag-i-stop ng uterine contractions. Another is steroid therapy. Ba't tayo nagbibigay ng steroid? Para saan ba ang steroid? Now, remember class, if a baby is still preterm, ang tendency niyan is hindi pa well-developed ang lungs. Tandaan nyo, the last organ to develop in the body of the fetus are the lungs. Now, we give steroids, specifically your betamethasone or dexamethasone. Betamethasone. And then the other one is dexamethasone. So ito class, these are steroids. So both of these will hasten fetal lung maturity. Ano ibig sabihin ng hasten? Ibig sabihin papabilisin niya ang pag-mature ng lungs ni baby. It hastens fetal lung maturity. That's why we need to give steroids. Now, ito class, paano naman doc kapag inai mo siya greater than 4 cm na malaki na yung opening niya? Pwede pa ba natin yan pigilan? Actually, hindi na class. Malapit na siyang mag-active labor. So, actually, nasa active labor na siya. So, kapag nasa active labor na, mahirap nang i-stop ang pag-labor ni mother. Magtutuloy-tuloy na yan. So, what you can do as the doctor, you need to give the steroid right away and then, of course, facilitate the delivery of the baby. Now, ano ba yung mga tocolytics natin? So, meron tayong mnemonics sa tocolytics natin or in other words, nire-relax nila yung uterus. Di ba yung uterus na nagko-contract siya? So, how do we relax them? So, we gave them tocolytics. So, ang mnemonic natin dyan is, it's not my time. Sabi ni baby, naku, 30 weeks pa lang ako, it's not my time. Sabi niya. So, I stands for indomethacin, which is a non-steroidal anti-inflammatory drug. Next is nifedipine. This is a calcium channel blocker. Ginagamit ito treatment sa high blood pressure. Next, we also have magnesium sulfate. This is a CNS depressant. And terbutaline, which is an adrenergic antagonist. Ang terbutaline class, ginagamit din ito na gamot para sa mga may asthma. So, isa-isahin natin. So, indomethacin, okay. Meron siyang mga contraindications kapag may renal or hepatic dysfunction, merong sakit sa kidneys or sa liver ang mother, peptic ulcer disease, and blood coagulopathy, yung mga may problema sa dugo, either pwedeng nagdurugo si nanay or nagka-clot yung blood niya. So, ang side effects nito, pwedeng magkaroon ng nausea at heartburn ang mother. Ang effects naman niya sa baby, pwedeng mag-close ang ductus arteriosus. So if you remember, ang ductus arteriosus, this is one of the shunts in the fetal circulation which connects the aorta with that of the pulmonary artery. And of course, another possible fetal side effect is oligohydramnios. So binibigay natin ang indomethacin to prevent preterm labor. Another drug, we have nifedipine. Itong nifedipine naman class is a calcium channel blocker. Ito yung sinasabi ko sa inyo na ginagamit din siya to treat high blood pressure. So it is contraindicated if ang mother is may heart problem or problem sa kidney, renal disorder. Ang side effects niya would be flushing, pwedeng bumaba ang BP. Kasi nga, di ba class, sabi ko ang nifedipine at it will also stop labor, pero ginagamit talaga siya na panggamot sa mataas na blood pressure. Pero effective din siya to stop labor. So wala naman siyang effect sa fetus, kaya maganda rin ang nifedipine na gamitin. Now, another is magnesium sulfate. So it is contraindicated with myasthenia gravis. Basahan nyo na lang ito class. And then, possible maternal effects ay flushing. So mamumula, parang mamumula yung nanay, flushing. Muscle weakness, pulmonary edema, and myocardial infarction. Sa baby naman, possibly hypotonia and respiratory depression. Kaya hindi natin masyadong ginagamit ito. So next is terbutaline. Ito yung sinasabi ko class, pwedeng gamot sa asthma. So contraindicated siya if merong problem si mother sa heart rate niya. Okay? And then maternal side effects may include pulmonary edema, myocardial infection, myocardial infarction, and hypertension. Sa baby naman, tachycardia and hyperglycemia. It's very important for you to take at least an effort to do this, to understand this, or alamin nyo man lang ano yung mga pangalan na ginagamit natin for preterm labor, ano yung mga pangalan ng mga gamot. So, it's not my time, indomethacin, nifedipine, magnesium sulfate, and terbutaline. Okay, so isa sa mga commonly asked question in the board exam is the drug terbutaline. So it is a beta-2 receptor. So for bronchial smooth muscles, it causes bronchodilation. Pinapaluwang niya yung mga airways natin. Kaya nga sabi ko ginagamit siya sa asthma. While sa uterus class, nire-relax niya rin yung smooth muscle. Therefore, nag-i-stop natin ang contraction of the uterus. But take note class, letter T, di ba? T, terbutaline, it is a tocolytic. Ibig sabihin, ini-stop niya ang contraction ng uterus. But it also causes a side effect which is tachycardia. Ibig sabihin, yung heart rate is nag-i-increase greater than 100 beats per minute. Okay, so that's terbutaline. So that is our topic for preterm labor. So we have here another topic. We have what we call Vasa Previa. Class, maalala niyo yung previa na term. Di ba meron tayong placenta previa? Anong ibig sabihin ng placenta previa? Ibig sabihin yung placenta, di ba ito yung placenta, no? Diyan dapat siya, pero dito siya, diba, kino-cover niya yung cervix. We call that placenta previa. Ganun naman class, pag sinabi natin vasa previa, parang ganun din yung concept. Pero vasa means vessels. What happens is the fetal vessels traverse the fetal membranes over the internal cervical os. Tingnan niyo to class, andito yung placenta, tapos andito yung umbilical cord natin, papunta dun sa umbilicus ng bata. Pero merong portion ng fetal blood vessels na walang cover na Wharton's jelly. Open na open siya. Tapos class, blina-block niya yung opening ng cervix. Kaya nga, vasa previa. Parang placenta previa, pero blood vessels yung nagpo-block. Okay, ano ba yung triad? Ano yung makikita natin na symptoms? So first, we have artificial rupture of membranes or yung tinatawag nating amniotomy. Ibig sabihin, artificially na pumuputok yung amniotic fluid natin. Another is nagkakaroon ngayon ng vaginal bleeding but it is also painless. Remember class, yung placenta previa, it is also manifested as third trimester bleeding na painless. So ang next na makikita natin dito class is fetal bradycardia. Cardia means heart rate, brady means slow. Bakit kaya magiging slow? Kasi imagine class, andito yung blood vessel, and if the uterus pushes or contracts, if nag-contract yan, ipupush na ngayon class yung head ng baby towards the blood vessels, maiipit yan. At pag naipit yan class, walang oxygen at nutrients na pupunta kay baby, bababa ang heart rate ni baby. Okay? So how do we diagnose a Vasa Previa class? We use an ultrasound. Pag in-ultrasound mo yan, makikita mo yung blood vessels, kino-cover niya yung cervix ng mother. And we also have what we call the Clay-Hauer-Bethke test, wherein we will test for fetal cell blood test. Okay? I-check natin dun sa vaginal bleeding ni mother. Kung meron tayong makitang fetal cell sa blood test, then it means we will consider this as Vasa Previa. Okay, anong management natin, class? Pwede mo ba yan i-deliver vaginally? Of course not, kasi class, kung pipilitin mo yan, pwedeng mag-break ang connection yan. Pag nag-break yan, pwedeng mamatay si baby kasi wala ng oxygen na pupunta, wala ng nutrients na pupunta sa kanya. Labor may take up to more than 8 hours kung hindi pa open ang cervix niya. So what will happen? Pwedeng mamatay ang baby natin. So what's the treatment? We have to deliver the baby immediately. Okay? So those are the first 3 topics that we have for intrapartum complications of pregnancy. Ano nangyayari sa heart rate ni baby? Bumababa or bumabagal? Ito